All right, here we have Kim in front of us, who's been a patient now from what, December?
End of December, and now it's April 1st.
And what was your chief complaint when I saw you, but you weren't really being treated for anything particularly?
Neck pain and just general achiness.
Why would you say you didn't do anything about it before?
I just assumed that it was getting older. I just thought it was age-related.
Wouldn't have anything to do with the amount of activity you have.
Well, do you mean in terms of
everything you do?
Yeah, I do a lot, but I just figured that the waking up every morning feeling like I was, 95 had to do with...
What specifically, how did you feel when you woke up?
Very achy. Just my neck and my, just the joints up here so achy, and achy up the base of my head, and...
Was that during the daytime?
Achy.
Do you have any headaches or neck aches during the day?
Sometimes headaches, but I think those are more hormonal. But just neck ache, yeah, constant neck ache. Constant neck ache. But worse in the morning and better after moving around a bit.
So as you were active, it was a lot better.
It improved. And I just assumed that maybe...
Were there any other symptoms?
Those were the primary ones, the ones that were bothering me the most.
All right, so you came in and we did an exam and found a lot of areas were quite tender. When we palpated, like on your wrist, on your shoulder, right over here.
Yep.
It almost was miserable, wasn't it?
Right. Very painful to touch.
But I guess you wouldn't want anybody to massage you much back there, or press it.
No, I do have my husband rub it, but it didn't necessarily help.
Yeah, okay. Well, let's show now. We've been wearing a splint for
3 months.
3 months. And let me see which one you've been... We had two of them.
Yep,
but
I have
where's
two.
the one you wore first?
This is the one I wore first. Let me just show it.
No, don't put it in very fast. Do it very slowly.
Okay, so this is the one I wore first.
Now kind of bring it up to your mouth and hold it there. Yeah. Back closer even. Closer to your mouth.
To my mouth or
to... Yeah. And this has got a little tongue port in it. All right, and we'll talk about that. Now, all right, now you can put it in. All right. Now that completely discludes her. In other words, she only bites where?
Right up front.
Right up front. And what have you noticed with that?
Well, I'm not achy anymore, and it was almost immediate.
When you say immediate, mean the next morning?
Yeah, the first night I noticed results.
Oh, okay.
But definitely over the course of a number of nights, it became really apparent that it was helping me.
And what was the other thing you told me?
About...
When you didn't put it in a couple
months. Oh, there were 2 nights that I forgot to wear it. Can I pull it out to talk, or you want to...
No, that's fine.
Okay. And I woke up achy immediately. It was a dramatic confirmation that what I was doing was helping. Okay.
Well, let's just show how you take it out. And just leave it right in front. Oh, yeah, right there. Now, there you can see the space. But you were having a little complaint about the space. Now, take it out and tell me about that.
Okay. So I noticed that my tongue loves being up there, and that's wonderfully helpful for keeping it in at night. Because I was really doubtful that I would actually keep the thing, and I thought I would pop it out like I did my retainer 30 years ago when I was a teenager. But my tongue wants to nestle up in here, and when this was a little bit thicker, I could feel like my tongue was pressing against it and it was creating a lot of resistance. So you just...
I reduced that, the thickness of it and the little inclines, and it feels better now.
Yeah, now my tongue fits in there.
Put that one down and pick up the other one.
So this is the daytime
splint. Hold it right by your mouth again, close. A little closer. Closer.
Okay.
Closer. All right. This has a couple little arms that stick out. Now you can push it in slowly. Oh, slowly. Go ahead. And it fits right. How does it fit?
Like that.
Okay. And it doesn't keep your mouth open quite as much, maybe?
Right.
As the others? But what did you tell me about that? Now this has a open space in the front, so the tongue, so you can just tip it down. Right there. Yeah, right there. And put it back. So that little bar across where the anterior teeth were hitting, now just hit only in the cuspid teeth, right?
Right.
Now open slowly and close again. Now, how does this feel compared to the other one?
Well, I like it. I like that my tongue has a lot of movement, and you can hear that my speech is not as affected.
But you haven't been wearing it during the daytime.
I haven't been wearing it.
You've been sneaking in at night.
I've been wearing this one at night because I like the idea of my tongue having free mobility.
And I'm not against that, because as long as it discludes your back teeth. What does that mean to you?
Well, it just prevents me from grinding them and crunching them together, which I'm inclined to do.
Especially clenching.
Yeah. Which is what I do all night long if I don't have it on. And in fact, I'll get into a lighter phase of sleep, and I catch myself really, you know, doing it, but it's not back here. It's happening.
But you're still getting into deep sleep.
Oh, I get into deep sleep, and I've been sleeping very well with it. But I catch myself sometimes, and I know that if I didn't have it in, I would be like really clenching.
All right. And since all this goes in there, I can go back and touch you right over here in this area where the levator scapulae muscle goes up to your neck, and it's not as anywhere. I think you almost fell down to the ground when I touched you the first time.
Yeah,
it hurt something.
Right, it's a lot less.
Because if you're palpating muscles, ladies and gentlemen, you can't palpate lightly. That's just not hiding what's there. Now, so what did we talk about besides this? Because you still have problems with your right.
Right.
What?
My ear pops.
And
the joint is more tender.
Yeah.
In fact, just touching it right now, it's tender.
And she told me one thing that's different. She said she also has
ringing.
Yeah.
In this ear.
And in most cases, when we hear about ringing, it's in both ear holes. But you have it mostly.
It's fine. I do have just very faint, but this is the one that has more.
So there's more joint displacement there. And she opens wide, and she has fairly deep overbite when the splints aren't in. Well, I think we'll. Do you have anything else to add at this point?
No, I'm very happy to have these splints.
Okay, now you're going to try to wear more
during the daytime. Which will be this model.
This model. Take it out again and show it slowly. Good. Just let it hold it right there. Yeah. Okay.
There
we go. Now you can take it all the way out.
Okay.
Now just smile again. Now bite down. Pull your lower lip down and keep smiling. You can see she's had a fairly deep overbite. Now open slowly. Yeah, close again. Not overly so, but enough that it makes her crunch and clench a lot during the daytime when she didn't have a splint in. Well, thank you very much, Kim.
You're welcome.